Dr David Oehme here. I'm a neurosurgeon and spine surgeon based in Melbourne, Australia, and today I'm going to be talking about complications of microdiscectomy surgery. Microdiscectomy surgery is used to treat disc herniation, and it's one of the most common operations done by spine surgeons. It's also a great operation to do as a spine surgeon, as most of the patients will get significant improvement in their pain following the surgery. Now, although it's a safe surgery in most patients, any surgery does carry risks. Now, before you consider having surgery for a disc prolapse, it's important that you speak to your own doctor and also your own spine surgeon to see if it's appropriate for you. Now, although most spine surgeries for disc herniation proceed in an uncomplicated fashion, there are some risks that it's important for you to be aware of. Now, the biggest risk with a disc herniation surgery is actually recurrent disc prolapse. So when we do a disc herniation surgery or microdiscectomy, we don't take out the whole intervertebral disc. We just take out the part of the disc that's pressing on the nerve. This means that there's still a whole lot of disc that is free to come out at some point in the future. Now, the risk of having more disc coming out in the future is as high as 5 or 10%. And it's not the surgeon's fault if you do get a recurrent disc prolapse. It's unfortunately the natural history of the illness that some patients will get a recurrent disc herniation. Now, a lot of patients will ask, what can I do to stop myself from getting a recurrent disc herniation? Now, in most patients, it's just bad luck why you get it. But it's important that in the immediate post-operative period that you do take things quietly. You can walk around, you can go about your day, but you can't do any competitive sports, you can't do any repetitive bending and twisting, and heavy lifting is off limits for the first 4 to 6 weeks after the surgery. If you follow this advice, you're less likely to have a recurrent disc herniation. Other risks of having a disc herniation surgery are infection. Now, in routine spine surgery, infection rates are 1% or less. The biggest risk that a lot of patients ask me about is there a risk that you could damage the nerves, or could I become paralyzed? The chance of damaging the nerve going to your leg with routine disc surgery is well less than 1%, and usually a very unlikely complication, and is not something that patients should be that fearful of going into surgery. Equally, the chance of becoming paralysed with routine microdiscectomy surgery is less than about 1 in 10,000. So the chances of having a nerve injury is not high, but the ability to help you with surgery is about 90% or more. Although bleeding can be a complication of most surgeries, it's very uncommon to get significant bleeding with microdiscectomy surgery. And in fact, the chance of needing a blood transfusion with microdiscectomy surgery is very low. All of the nerves within the spine float in a sac. Now, that sac is filled with fluid. Sometimes when we're removing the disc, it can tear a hole in the lining of that sac, and it can lead to the spinal fluid leaking out. This is what we call a CSF leak. Now, in routine spine surgery, this happens in up to 5% of cases. Now, it's not a disaster if this happens and we repair it at the time, but it does have an implication for how long you'll stay in hospital after the operation, as typically we'll keep you in hospital for an extra 1 to 2 days to check that the wound heals in a satisfactory fashion. That's about it. Otherwise, microdiscectomy surgery is a pretty safe surgery. On a busy week, I might do 10. On a quiet week, I might do 2 to 3. And by far, the majority of patients are very happy with the outcome. Most patients will be in hospital for 1 to 2 days, but we do even do them as day cases on occasion. For more information about disc surgery, please check out my website, www.doneurosurgery.com. But please remember, this is not advice specific to your condition. It's important that you do discuss this with your general practitioner or your spinal surgeon to see if disc surgery is appropriate for you.